Hello, everybody. Our audience who speak English, how are you? We will start today a very nice webinar, just talking about the news. News, it is no news. It is the posturometer, how we measure the occlusion. Sometimes we said how we can measure the dental occlusion, how is affecting the foot support, and that is the topic of this particular webinar. How can the precontacts, what is a precontact? Well, a precontact is some teeth who touch before. Imagine we have here maxillary, a teeth we're talking here who make a deviation of the jaw, this precontact. And the deviation of the jaw, as we know, is affecting the posture. And chronically, it will affect the foot support. How we can demonstrate it? With an instrument. The instrument is posturometer. The posturometer will measure our static posture and we can observe what happened. I will to introduce just a refresh of the posturometer, just to remember how it works, because if you do not how it works, you don't understand what happened with the foot support. And we do a little review and regarding the posturometer, how we can measure the posture of our body. We going ahead with this presentation and show you how is working the precontact. Dental precontacts, how they affect the foot support. This man who was Galileo Galilei, all scientific is miserable. He cannot demonstrate. I put always in my webinar that, because if we can measure, we can demonstrate our clinical opinion. Remember, always, clinical opinion is an opinion. If we can be true or false. But if we measure it, it will be science. And that is the effect of posturometer measure. And the best way to measure posture, diagnose postural imbalance, and pathologies, and follow the therapies. That is the way with this instrument. As you know, in our school, we have a clinical diagnosis, instrumental diagnosis, and complementary analysis. This is all medical science have this. Posturometry is the instrumental diagnosis for posture. And we will go ahead through the presentation. Posturometer, simple instrument who measure in 30 seconds. You can do a measure, analyze, and see the result. These instruments, as you remember, and if you do not remember, I will refresh the concept. This is specially designed to detect the load in correspondence with the following three areas of Capangin. First metatarsus, fifth metatarsus, and calcaneus. We have here three sensors, and we can take the measurement, and the software will analyze. And later I will show you also the software. This is the software. I will show you later, okay? And posturometer, as I told you before, is an objective instrument, and that's very important in medicine, medical sciences. Let's remember, postural loads, according to Capangin, arrive to the ground through a vertical to the tibial joint and distribute on the foot 3-6 in the calcaneus, 2-6 in the first metatarsus, 1 in the fifth. This is the load distribution. Foot 3-6, 2-6, 1-6. And we measure that. The basic protocol is mouth open, eyes open, mouth closed, eyes open, and the eyes closed and mouth open. Sorry for the Spanish. I put the Spanish translation here. This is direct. All right, okay, that is the direct translation. But I will change it. Just as better. Which that's a mistake. When we do direct, we do mistake. Sorry about that. I will change it. Don't be worried. That we have 3 different loads. This is the basic protocol. Yes, and we can analyze in these 3 loads. Yeah, that's it. Let me put it better. Yeah, that's it. And here is basic protocol. Okay. Okay, we have in English now. Okay, sorry about that. That is direct. Okay, this is the basic protocol. Open mouth, open eyes. Mouth close, eyes open. Mouth open, eyes close. And then what we are measuring in these 3 exams. What we measure? We measure in the first exam the posture of our patient. Second exam, occlusion, that means mouth, and the third one, the foot support. That's the measure in the basic protocol. To analyze, to analyze the mouth, we will see posturometry, the load distribution, and the increase of our body load. This is the graph. We analyze the Kaplanji areas, the torsion, the oscillation, the barycenter, and the overload. These areas of Kaplanji and this one overload will show us how it's affecting the mouth, the occlusion. And as I told you, this is an instrument, is practically an objective instrument. Look at some sample here. Mouth closed here on the right, mouth open on the left. Here, the mouth is causing a problem. Look at here, 1.7 kilos of overload when this patient closed the mouth 4.6. And look at the body weight distribution. No reds. And here we are reds. We can analyze, we can study that. Occlusion and posturometry, we said. The occlusion, we can see the occlusion in the posturometry. That is a research I did many, many years ago, more than 30 years ago. Study the effect of the precontacts of the teeth and the effect to the feet. And look, the contacts in the incisors and canines, that is for people who are not dentists, is the anterior teeth, reduce the load on the first metatarsus, homolateral. the contacts or pre-contacts in the premolars and molar area, we say that the occlusal plane, when we chew, when we eat, where we eat, some pre-contact there reduce the load in the fifth metatarsus. And contacts in the second and third molar area, the back part of the teeth, they reduce the load in the calcaneus. Look at how affect the precontacts our feet. That's the schema. The teeth between 1 and 3, that mean anterior, we call that in dentistry anterior guide, between canine to canine. Any precontacts there reduce the load of first metatarsus. The precontacts in the area of, we call that occlusal plane, between first premolar and first molar, we trim there. They reduce any precontact there, they reduce into the fifth metatarsus. And precontacts in the last part of the teeth. That means second and third molar, we call that in dentistry posterior guide or speak curve. They reduce the load in the calcaneus. The schema into the teeth. First metatarso, anterior guide. Fifth metatarso, occlusal plane. And speaker calcaneus. That's the schema seeing the teeth, but we can measure that. Knowing how it's working, we can observe, we can measure, and we can see what happened every time we have a pre-contact in this area. And let me go ahead with the presentation. Look at here. This is a patient who has 4 kilos overload. This area, less load, we can suspect a pre-contact in the anterior guide. The triangle on the back is less load. Pre-contact create less load there. Sorry. And increasing here, look at. Maybe pre-contact, lateral deviation, increasing here, overload. For 0.6 kilos. And look at here. This patient mouth open, no any torsion, no fat distribution. Close his mouth and look at how it's changed. Before and after. Open mouth, normal. Close his mouth, alteration. That is the proof that the occlusion, the jaw position, can alter the posture. Instrument saying that. It's not imagination. The instrument is saying that. Don't forget it. Measure is science. And we study this patient. It's an occlusal diagnosis, little occlusal diagnosis. Here in this graph, the mouth is open. And look at 6.2 kilos overload to the left. Patient close its mouth here. Lose a little bit, maybe a pre-contact. who is creating overload in the other side, escape from the pre-contact and overload in the body. As you see, it is an instrument who is showing us how is the effect of the craniofacial system. We said craniofacial system. We said the craniofacial system effect when is dysfunctional to the posture. This is an instrument you can measure and you can observe that. And I will try now to show you in direct some registration. Let me go to the posturometer there. All right, okay. I have to cancel there the name of the patient, you know, because it's the software is showing me the whole. Okay, if you see here, if you see here, this patient is 2 exams, mouse open, mouse close. And in this moment, you can, you know, the posturometer, if you play here, you can see how is the effect of the body during the registration. This is 30 seconds. Quiz 10 is 1. How it's working, yes. And when the exam is finished, you can analyze. This recorder is saving in the server, in our cloud. We can share with different professionals, etc., etc. Yeah, okay. And if you see here, you can observe. Let me go ahead for this. Let me go clear here. Sorry. Let me clear, and we go stop. And we see the registration. And what happened in this patient? If you analyze before the registration, I will share again that. Let me go ahead to this part of the presentation. Let me go ahead in the time. Sorry. If you remember that the presentation, look at it. Here was we go in here to this part. If you remember that, we're going back. Focus this anterior guide, occlusal plane, speaker. It is important we understand that, because if we understand that, we can study what happened with the patient, with the patient, you know, with the patient in life. I will show you now. Let me 1 second. I will share the screen of the posturometer. Yeah, here is, and this is the patient. Open mouse, mouse close. If you see here in this part, we have 1.1.7. Close the mouse, 2.7. But look at the distribution here. No red. When he's closing his mouse, maybe some pre-contact is in this area. You see, before was green, now is red, was creating a little retroposition of the body, overloading the calcaneo and creating a 2.7 overload. You can study also the body center of the foot, etc. But that's important, this graphic, because in this graphic we can see that pre-contacts in this area, pre-contact in this area, in the anterior area here, maybe an incisor or maybe a canine on the lateral incisor, pre-contact here will create a down position of the jaw, overloading the calcaneus, creating overload here. Pre-contact here in the anterior guide, less load here, more load here, and sometimes, most of the time, is a lateral deviation of the jaw. As you see, an instrument can show us how the dental occlusion change the jaw position and overload the feet. That is the connection between craniofacial system and the rest of the body. I hope you enjoy our presentation. If you like the video, do a like for the video, subscribe to our channel if you like, ring the bell, and you can see the whole information we have in our channel. I hope you enjoy it, and I hope I have a lot of you next time in our live presentation, and some people see the videos later when they are at home. Okay, bye everybody. See you in the next presentation, and I hope I see a lot of you in our channel. Bye.